if our technology was in the hands of the physicians are seeing me and talking to my family, this wouldn't be happening. Like I would have found out that I have cancer before I did, and I will have much better opportunities to challenge this and to overcome the disease or the condition. So we got to see in firsthand how badly structured the system is, how derailed are the incentives, and how much does a single month affect the survival chances of an oncology patient.
Welcome to Startup Health Now, the podcast where we celebrate the entrepreneurs and innovators reimagining the future of health. I'm your host, Logan Plaster. Every company in the Startup Health portfolio can draw a line between their business objectives and a very real human impact. Even companies working on highly technical or administrative solutions are doing so at the end of the day in order to help people get the care they need faster or better. Our stance is that no database integration, supply chain management tool, or insurance platform should exist apart from this ability to improve lives. In other words, health innovation is personal. For some founders, like my guest today, that human face of healthcare technology is startlingly clear. My guest is Luis Santiago, the CEO and co-founder of PEGASI, which Startup Health backed in 2020. PEGASI is in the business of digitizing health information systems in Latin America, and they're focusing on upgrading those systems within oncology so that cancer patients can get diagnosed and treated faster. That mission gained a tragic level of clarity this year as PEGASI's CTO, Janper Garbi, went through a devastating battle with cancer. Luis Santiago shares that personal story and how it could have ended differently had the hospital been using a digital platform to speed up diagnosis and treatment. But this isn't just a story about what could have been, but how a tragedy becomes fuel for a health moonshot that could improve the lives of millions of people. Without further ado, here's my interview with Luis Santiago. Luis Santiago, thank you so much for joining me today for Startup Health Now.
Thank you very much, Logan. It's great to be here and to be with the Startup Health family. The Health Transformers Network is a very close part of PEGASI's family in our hearts.
We're here to talk about PEGASI, this company that you've started, and just the journey that you've gone over, and some of the very personal things that have happened within the company that have spurred you, even further on. So let's start with a 1-minute flyover of what you've built with PEGASI, kind of where it's at right now. Then we'll unpack kind of where you come from and more of the story, but just introduce yourself to our listeners.
Well, thank you, Logan. PEGASI is a company that's dedicated to smart management of healthcare information for the developing world. Our focus is making this information accessible, clear, and useful for patients, physicians, and service providers. Given the last few months where we've seen that we can have a huge impact is the oncology industry, where there's a huge need for digital transformation. So we focus ourselves into developing oncology information systems. And as you said, there's a very personal story that has happened inside of the company that has validated that what we are doing is something that can have a very, very big impact in the lives of many Latin Americans and hopefully many people in the world.
Okay, so information systems, focusing now on oncology. So let's step back from that a minute and let's understand a bit about who you are, Luis. Where are you from? How did you get into healthcare technology?
I'm a second-generation entrepreneur in my family. My dad used to be in the oil industry in Venezuela, one of the first people that learned how to code in the country. And at some point in his career, he had the opportunity to develop a healthcare information system for very large oil industry hospitals. This was 400 beds. And after that point, when he resigned the oil industry, he decided to stay specifically developing systems for hospitals. And as he saw that digital transformation had a very big impact in how well you can manage patients. So he spent from 1992 since, well, until today, he's my co-founder, developing healthcare information systems. And started on the footsteps of the company that he had founded in 2008 when I graduated college. And now I've been 14 years into product ownership, developing products for healthcare information systems, and also having a lot of experience into digital transformation, more on the human side as well. Like implementing a system is not just clicking some buttons on a server or having someone accessing a platform. It's all about how you translate their business's processes and get them into a platform. So those are like my two, let's say, experiences, stronger experiences is first, of course, designing products and services that can help digital transformation in the healthcare sector. But I think the second and the strongest that I have is taking the information workflows or taking the process workflows that happen in healthcare and translating them into software. So you have a very seamless translation of their processes into a digital format.
Now, you started your career in Venezuela. You said you're from Venezuela?
Yeah, exactly. I am from Venezuela, and
But
I've been
your focus
yeah
is on Latin America more generally. Kind of where have you worked and focused so far?
yeah we have a focus on Latin America specifically. We currently have operations in Venezuela, of course. We have a lot of clients there: Dominican Republic, Chile, Ecuador, Peru, and Colombia. Those are the countries that we are covering with PEGASI right now. Originally, and until like 2016, most of our customers were in Venezuela. We have very, very few Venezuelans that went abroad. Those were customers in other countries. But now, right now, we serve 6 countries with PEGASI.
Help us understand a picture of the healthcare system in Latin America, particularly where you have rolled out PEGASI, where you have intimate knowledge, and sort of paint us a picture for what was broken as it pertains to data integration, healthcare data.
Well, and that's a very good question, Logan, or a very good message. The idea is that when you see Latin America from other parts of the world, you start to think that it's the same region with very similar qualities to each country. But the fact is that every country is completely different. You have different laws and different systems. For example, there are some countries in Latin America that have a social security. There are countries that don't have social security, but security is paid directly with the workers' wages. So that makes an array of systems are completely different. The fact that still remains in each of those countries, and it's quite similar, is that information on the healthcare sector is completely siloed. You have hospitals that don't communicate with each other. Most of records are paper-based records. And the idea of having some sort of unified healthcare system at some levels in Latin America remains as an utopia, considering that many of those centers still work in paper. So there is no ability for them to create formats that could digitize that information and share them so you can have a better patient attention. And that's the reality that we're trying to transform in Latin America.
Yeah, and at a very practical level, kind of walk us through how PEGASI addresses that challenge.
Yeah, and it's very interesting that we first engage with the stakeholders in the institution and try to pinpoint which are the more specific pain points that you could address in order to speed up the implementation process in their clinic. Like if you have someone that sees a great benefit from the product or service that they are acquiring, they are much more willing to change other processes inside of the system. So on the first side, there's a lot of weight for what we do on the implementation process. And then, for example, let's say we evidence that agenda and missed consultation is the most important pain point in that institution. So we transform that process first. Then, for example, we go to the EHR transformation, and then we go to administrative transformation using PEGASI tools in order to streamline the processes and integrating all of the information into a single funnel that involves the patient in their clinical decision support. So that means that in the end, we start going from what's the fire inside of the institution, and then rolling out other capabilities that allow that institution to become 100% digital in an average time between 6 to 12 months.
Mm. Now, I understand. Well, I love that you have focused not just on the technology side, but on the human side of implementation. And I know that you have a background in journalism in addition to technology. And I wonder how that background, as a content creator, as a writer, as someone who appreciates story and just the human side of storytelling, how that has informed the way you think about the human side of integrating technology like this.
Well, and that's very important, Logan, and that's something that I try to convey to all the people that work with me in PEGASI. The transformation begins from willingness. As we talk in startup health in the circles, there's a mood that a person has that's transactive mood. So in order for you to transact and to be thinking about transforming for a better for performing a better service, then you probably need to be very aware that the thing that is being solved by this third party that you are hiring is something that will allow you first to have a better quality of life, since you're going to be looking at a lot less work. Second, that you're going to be providing much better care for your patients. And a third, and most important, that this is going to increase the revenue from the organization. So in every step that you take inside of the organization, you have to focus on getting people in this transactive mood, so they are willing to invest their time and limited energies into creating a better institution for themselves, for the patients, and for the institution itself. So,
do you have any sort of like tricks you use that you have in your back pocket for sort of getting people to switch their mindset?
Yeah, I think the first one is just listening. I think we entrepreneurs like to, and we are accustomed to speaking high volumes about what we do and the quality of our products and services. And I think one of the missed qualities that you need to have when you are implementing is listening to the customer, listening to their needs, to their pain points, and knowing where to focus your intention and this first part that generates a great experience, so they are willing to do the rest of the job.
Yeah, I think that's a good segue to talk about how you have refocused the company around oncology.
Yes.
What was it that you heard in your listening campaigns, and what was it that you saw that caused you to hone in on cancer care?
Yeah, there was a very interesting initiative that we were part since September 2019. There was a call for entrepreneurs in the healthcare sector done by Roche Laboratories in Mexico.
Okay.
I got to know of the initiative. It's called Health Tech Builders Lab from Startup Chile. They told me like, hey, you're one of the guys on the oncology sector in our generation, so this is something very interesting for you to apply. And they selected 5 entrepreneurs out of 80 that went for the call, and I was the only non-Mexican entrepreneur that they selected. When I got into that project, which was very interesting, I came to know the problem that was being had in Mexico for communication between the National Cancer Institute and the National Genomics Medicine Institute. They weren't speaking. Like at some point, you had a patient that had a very, very large amount of genomic studies done, and that information wasn't getting on time to the National Cancer Institute. So by the time that information got there, they already had made a decision about the patient's treatment. And as you know, the more information you have on the genomic side of the patient, you're probably going to create a better treatment plan for them. So this thing about their applications not being able to interoperate was creating was diminishing the survival rate for their patients. And at this moment in September 2019, I saw there was a huge opportunity into improving patient care if you center around how to get all of the information, whether imagenology information, clinical laboratory information, biomarker information, and genomic information in the hands of the physician. So when they made the decision in how to treat the patient, it was the best informed decision possible. And after that time, we started seeing that there was a huge need for digital transformation on the oncology sector, and more we started getting involved in the area.
Got it. And at some point, as you and I have discussed on previous calls, this sort of intellectual concept became very personal. So I want you to tell me a bit about your colleague, Janper Garbi.
Yeah, well, it's a difficult experience that we have had so far in PEGASI. I used to work with Janper since 2010. I think it was the time he started working with my dad, actually. At the point, my dad was also on the public sector. He was leading technology operations of the government of Miranda in Venezuela. And he had an understudy, a technician. It was Janper. At the time, Janper taught himself how to code in Visual.net, and my dad saw a huge potential with him in him, and we brought him to the company that we had in Venezuela for a short amount of time. Like it was like 4 to 5 months or something like that. And he got hired from the National Treasury in Venezuela, the tax department, like the IRS, but the Venezuelan version of it. And for his native region, he was from inside of Venezuela. So he left the company at that time. I do have to say that Janper had he was an engineer in computation, but in computers, in computer science. But he also was a lawyer and an accountant. He had 3 careers. An incredible fellow. So he went and served the Venezuelan IRS for around 10 years. And in 2018, he migrated to Peru because the situation in Venezuela got so dire. Like everyone else in Venezuela started migrating. I migrated in 2017. My mom and my dad migrated in 2019. So, and now, right now, it's like 6.5 million Venezuelans that have left the country due to the situation that we are in. So he migrated to Peru first, and he had a very rough time in Peru. He couldn't find a job that was paying like well at all. So he was doing Uber driving in Lima, and he was having a very hard time. And at that point in history, I was working in PEGASI. I recently came to Chile from Mexico to join the Startup Chile program. And my dad told me that Janper was looking for a job. I said, like, this is the guy that I need right now. Mm-hmm. And I asked him to fill the position of a software developer, first on an entry level. And then he started quickly rising in the ranks of the organization. So at the point in 2020, I had some discussions with my previous CTO, and we ended the parting ways. Like he exited the company in 2020, and Janper filled the role. Like at that time, he had the ability and the knowledge that a person that had experienced microservice architecture would have developed in 7 years. And this is something that he developed in 2 years. And at the point he started being my right hand. My left hand is Axel, who was coordinating the development department more on the front and back end side, but Janper became the main architect of the company on the software side.
Is he older than you? Is he more your father's generation or in between?
No, he was 3 years older than me.
Okay,
At
same
the time
generation.
of at the time of his death, he was 38. Mhm.
So he became your CTO. And where was this in position to your decisions? This was a year after deciding to focus on oncology?
No, this was previous. He started working as the acting architect. I didn't. I kept the role of CTO for myself, as I was coordinating architecture development. Jean-Pierre was coordinating architecture development under my. We had comments and we always discussed the type of solutions that we created. He created the solutions along with the people in his team, and then the other part of the more on the development side, relied on Axel, who's the other person that was acting chief. Like the roles that they had inside of our Scrum team were chapter lead. Jean-Pierre was the chapter lead on the architecture side, and Axel is the chapter lead on the development side.
When did Janper get his first diagnosis?
That was something that took a long while. I think it was May 2021 when he started having a very, very bad cough. The cough kept him awake at night, and then he started developing petechia, like these small marks in his skin. And they thought this was related to asthma. He was asthmatic, and the general humidity of Lima made it really hard for him to stay healthy and not fall sick over and over again. So they thought this was related to that, but then he started showing symptoms of anemia and massive headaches. So they started doing a lot of tests. I think this was between May and September, and they couldn't locate the source of the disease. He started like having a lot of tests being done by an internist, but like he usually had to wait a long time after he got the results for the internist to give him an appointment. So this usually took between 7 to 15 days to review the results of a certain test. And none of the tests were conclusive. At some point, the internist thought that he had something that's called a clonic gammopathy, given the signs that he was showing. And they were desperate. They couldn't find the source of the disease. Like at some point, he started eating a lot of spinach that was recommended to him because of the anemia. And his wife got like really upset about not finding a result, and she paid him a PET scan. So this positronic tomography started when we got the results. They were very bad. He had around a 3.5 centimeters tumor in his kidney, and they already had metastasized to the lungs and the brain.
And this
So
he discovered this because his wife got so frustrated that she just took action and ordered a PET scan.
Exactly, and the insurance company wouldn't pay for that test. So that test he had to pay that on his own. Like he had no coverage for that specific test, and that was the reality for most of his treatment.
Yeah. What was it about the system that made that case? Or why was it that he couldn't get the PET scan when he needed it and that it wasn't paid for? And then the sort of the follow up is that generalizable to other regions in Latin America?
Yeah, I think it's generalized in Latin America as a whole. There's no incentives, like no marked incentives in the system to pay for early detection. Even if Jean-Pierre's treatments ended up costing his life, and being extremely expensive given the stage of the cancer where he was found. There is no lineup of the incentives either in the public or the private sector to find to locate patients with cancer before it becomes too late. So I think it's a generalized situation. Like, for example, you have to go through a lot of paperwork in order to get something like a PET scan recommended. And even if you have a PET scan and it shows it's negative in the results, hopefully, then it's going to be much cheaper for you as a company, as an insurance company, to find a patient on a PET scan that costs $1,500 than to pay for a $40,000 treatment. So even in that situation, medicine in general in Latin America is extremely reactive. Prevention is something that's not taken into account in most of the systems. Even like the Chilean system, which is like I would say the most advanced system in Latin America, is very precarious in terms of prevention. This is something that's not built into the system. You go to the physician when you're sick, not because you have worrying symptoms, which was Japier's case.
When was it that he got the results from the PET scan and realized how serious this was?
I think it was September 2021. He sent the results to us, to the directives of the company. One of my directives is Dr. Luis Santiago. He's an MD intensivist, but he is also a man who has worked in a lot of the healthcare areas. One of the areas that he worked in the past 10 years is cancer care. So he knows a lot about cancer. I wouldn't say he knows more of than an oncologist, but he knows a lot.
Yeah.
So he reviewed the results and he said, like, this is not good. He had something that's called a secondarism, which is the clinical term for metastasis in his lungs. At the time, he had a very early onset in the brain. So when we were talking in the direction in the management of PEGASI about the situation, Janper's situation, we said like there's a very slim chance right now that he has to walk out of this.
Do you remember?
And mhm.
Do you remember what you were thinking or feeling when you received that news?
Oh, it was a very rough time. We were also going through a very rough time in PEGASI in general, as we were doing the transition to start working on oncology. And I remember thinking to myself that we didn't get there early enough. Like at that time, when we had the PET scan, Yang had to fight to get his case presented to an oncology hospital, a hospital that had an oncology department, because the one that was covering his area didn't have an oncology specialty. So by the time the case got discussed, the discussion, the gathering of the evidence, and the discussion itself took around 2.5 months. And I remember thinking to myself, if these guys had Pegasus tumor board, the decision on Jean-Pierre's case could have come 2.5 months early. And like the studies say that in cancer, for every month that you don't you don't start the patient's treatment, their survival rate drops between 6 to 13%. So this weight of having a firm diagnosis and starting his treatment probably cost him between 13 to 26% of the survival rate. And in the case of the type of tumor that he had clear cells kidney tumor. If treated between stages 1 to 2, stages 0 to 2, it has like a 94% survival rate. But if you board it up, when it's 3 or 4, it's less than 5%. So those months meant Jean-Pierre's life.
So you got this news and you thought, if we could have gotten this to market sooner, something might have been different. Um,
Correct.
help me understand the pieces there. Did you say a tumor board that was a part of your platform?
Yes. One of
Talk to me
the
about how that would have sped things up.
No, that's great. Yeah, one of the key parts of our oncology information system, PEGASI is a tool that's called a virtual tumor board. The virtual tumor board is composed of four modules. The first one connects to the existing EHR and also connects to the radiology information system, also connects to the clinical lab system, the LIS, the LIMS from the anatomical pathology, gets all the information into the same platform and allows you just with a few clicks to prepare a case to be discussed in an oncology board, that's called a tumor board. Okay, so and you can also get the information from, for example, genomic testing delivered directly into the case preparation. So this task usually in hospital is about 10 hours per case prepared, and we managed to narrow that down to just 1 hour to properly prepare a single case to be exposed in the tumor board. Then the second module allows you to have this conversation or this discussion in order to create a firm diagnosis for the patient and create a treatment plan. Usually, here in Latin America, clinics and hospitals discuss around 14 cases per week per tumor board. Like if you have, for example, people who are discussing genitourinary tumors, they discuss 14 cases. If you have a long tumor discussion, that's going to create 14 conclusions. In our experience right now, we rise the amount of case discussed from 14 to 18 of those cases. So there's 4 extra patients that have an earlier diagnosis and treatment.
So
And
you're able to use the platform to speed up diagnosis and treatment.
yes.
That doesn't address the issue. I wonder how you think about in the future addressing this issue of negative incentives. You said in this particular situation, whoever was paying for the care wasn't incentivized to even seek a faster diagnosis. So how do you think through that?
Yeah, I think there's an incentive in, for example, helping. Like when you narrow down the amount of work that's being done by the institutions by digitizing the information, and then you start processing that information to create the clinical decision support systems that are based on actual experiences, then you can get faster diagnosis and a large amount of curated data that you can use to train your artificial intelligence algorithm. So that means you can first detect the symptoms earlier, second, diagnose the patient faster and more accurately, and third and final, evidence when the patient is about to enter a catastrophic disease that's probably going to cost a lot of money. So that means that you can have the information ready that will that will make whoever's paying for the treatment, whether the government or insurance companies, not to incur in that cost. And that creates a matrix that incentivizes prevention. Prevention right now in Latin America pretty much doesn't happen, not because you don't want to prevent, but there's actually no way in telling when the patient is at risk of getting into a catastrophic disease. So if you start tracking the patients that are having that catastrophic disease and creating an information matrix or an information algorithm that allows you to detect when they're going to enter, then you have an incentive of preventing because there's an actual measure in how much money as a system could you save. So, and it's pretty sad that we're talking about human lives, but usually when you are talking about population health, this is something that's run by the numbers. And if there's an investment that you need to make in order to transform a reactive healthcare system into a preventative healthcare system, then if you're doing that equation, you need valid numbers in order to be able to solve the equation itself. So that means that if you don't have any track record whatsoever about how much could you save, there's no way that you are going to create the incentive for investment. So the first incentive for investment is actually being able to say a number and how much could you be saving.
Interesting. We're talking about these two issues, one being the incredibly personal story of an individual who ended up losing their life, and then on the other end, the need for just hard numbers about cost in order to move the needle on public health measures. And the two are so inextricably linked, aren't they?
Yes, that's correct.
You can't move to the individual life change until you really get these big data pieces pulled together.
Exactly.
Tell me about the final months of Janper's life. What happened after in the months after your team realized the seriousness of the diagnosis?
Yeah, he started, as I said, there's was a lot of time in his last months that was spent fighting with the insurance company that he had in Peru in order to get care. When he finally got the care approved, he had the standardized care for kidney cancer. It was an oral pill that made him really, really ill. He had to take one per day with a very high dose, as corresponds to a stage 4 clear cell kidney cancer. And he was really ill all the time. He felt really bad. He was having massive headaches. At some point, he lost, I think it was December, like early December, he lost his ability to speak. Um, in the first few days of adapting to the medication, to the chemotherapy, where was really bad. He started getting used to it. He did 3 rounds of chemotherapy. I think the last one was early March. But at February, I remember it was the final weekend of February. On Monday, he called me. Like he said, he couldn't work. He was in his bed, like really bored. Like he was the type of person that would stay awake like late at night, studying new technologies and new architectures and things that we could create to have a better architecture in PEGASI. And he called me like on Saturdays or on Sundays, say like, "Hey Luis, when I get better and I get back to work, and I want to implement this and this and that." And it was really strange for me. There was one Sunday that he didn't call me or send me any text or something. And I think this was like the last Sunday in February. And on Monday he called me really early. He could barely speak, and he told me that he had a seizure, that he fell, that hurt most of his body on the left side. He had a very huge bruise, and they took him to emergency. And they did a full body scan, a tomography, and they saw 2 tumors in his brain that had metastasized. And he had a conversation with his oncologist, and she told him to start with radiotherapy. So I think it was most of March was spent on radiotherapy. I think it was 10 sessions of radiotherapy, and I think it was 5 days after the session, the last one, that he said like he got into a meeting with us, and he said like, "Hey guys, I'm not feeling really well. It's really hard for me to talk." I remember he had the left side of his lip like completely sealed. He wasn't moving it. So he had like most of half of his body was paralyzed due to the tumor in his head. And I remember his wife calling me in tears, telling me that they found like they got the results of the latest tomography, and there were the electro. This was an electro MRI, magnetic resonance, and there weren't just 2 tumors, there were 4. And The oncologist told her that there was nothing to be done, that the neurologist that was seeing Jan told him there's nothing to be done, that those tumors are in an inoperable place of the brain. And I remember asking a customer of ours in Venezuela that if there was something to be done, and he told me there's nothing to be done here. The tumors are placed in places that are inaccessible for a surgery. So they sent him home. Told him to be as good, like told his family to make him as comfortable as possible, but it was just a matter of time. And this was the first Monday of April when his wife called me and said that he died. In the previous days that she was calling me, like they spent all of the money that they had in order to pay for his treatment, because most of the treatment had to be procured in the private side, and they didn't even have money to have a cremation for him. So I think that the least we could do as a company and as a family was to pay for his funeral services, which is something that I'm glad I had the opportunity to do. But it was really hard. Like the whole time I saw that he had the willingness to go back to work because he loved what he did, and he couldn't. He just couldn't, and that was really, really, really rough.
How old was he when he passed away?
38.
38 years. Wow. I'm sorry your team had to go through that.
Yeah.
Luis, is this just a really tragic story for your team, or does this change your trajectory and really imprint on the future of PEGASI, and in what way?
No, I think we as a team had the chance to be on the front seat of something we could have prevented. Janper included. Like he said, and several times, like he said, if our technology was in the hands of the physicians are seeing me and talking to my family, this wouldn't be happening. Like I would have found out that I have cancer before I did, and I will have much better opportunities to challenge this and to overcome the disease or the condition. So we got to see in firsthand how badly structured the system is, how derailed are the incentives, and how much does a single month affect the survival chances of an oncology patient. Like, there's something I didn't tell you, but at some point, I think the physician that was first seeing Jean-Pierre, the internist, had him to be had an ecography of him, like a complete body ecography, and the echographist detected the lump on his kidney, and the echographist, I remember Jean-Pierre telling me that told him that he didn't like that, and the internist said like, but that's something that's probably a deformity that you had at birth, since birth, and he didn't get that checked because the internist didn't have the incentives to actually check out if that lump was actually cancer. So we got to experiment at first hand what would have happened if that internist had the resources and the push against him to early detect what was Jean-Pierre's disease. And that would have been an incentive, and that would have meant that Jean-Pierre got an early detection and a drastic increase in survival rate.
Every founder of every startup comes against major obstacles and pitfalls in their journey. I can only imagine that this is going to really live on in your mind when you come up against one of these hurdles.
Yes. If we were able to, like, we are just gathering our bearings in PEGASI, and because Jean-Pierre was something that was later explained by a mentor, that's the term is superhero. We all in our startups have one or two of those people that take 5, 6 mantles on themselves and make things work in the early stages where you cannot have 20 employees. And Janper took on his own to redeem what wasn't built when our former CTO left the company. And he studied day and night in order to make those things right. And now that we don't have him, it's been really, really hard to encompassing the breadth of the things that he did.
Yeah.
There was a lot of things that were done by him that we didn't know. So at this point, it's like
That's always
it's
the
not
way. It's always the way it is with your best team members, isn't it?
exactly. And
Yeah.
there's a lot of nostalgia when we go into our code repository and we start doing some code archaeology, like we are Indiana Jones in there, and we start finding code snippets that were written by him that are genius. We say like, how did he get this incredible idea to solve this issue? There's so much of him in PEGASI. There's so much of his mind and his heart, and there's no way we in PEGASI let this slide.
Yeah.
We have to make it better for cancer patients in his memory.
Luis, that's a beautiful note to end on. Janper will live on in PEGASI, in the code, but then also in your Health Moonshot mission to bring faster, better care to cancer patients all around the world, starting in Latin America. So thank you for sharing this story with me. This is still fresh, I know, but it really speaks to the mission that you're on and how important it is. So I thank you.
No, and thank you very much, Logan, for the time to share this story. And I think the goal is the moonshot. The goal is to change things for patients so they don't have to experiment the sad reality that Janper had to go through.
Exactly. Luis, thank you so much. Keep pushing. We can't wait to see what you come out with next with PEGASI, and we wish your team all the best.
Thank you very much, Logan, and you guys at Startup Health thank you very much for your continuous support. You're the best.
Take care. Be well.
Thanks for listening to Startup Health Now. Startup Health invests in health transformers from around the world who are committed to achieving audacious health moonshots. If you want to learn how you can join this community of entrepreneurs, or if you want to connect with one of our 380 companies, go to startuphealth.com. If you'd like to learn how you can invest in our Health Moonshot Impact Fund in collaboration with AngelList, go to healthmoonshots.com. Thanks for listening to Startup Health Now. We'll be back next week.